welcome every. Oh, sorry, started recording. Welcome everybody to this Congress Fringe. It's the end of Congress. We are seeing Congress out with a really important issue. So I'm really pleased that we've got so many people wanting to come and talk today about long COVID and the impact that's having on all workers and everybody, but particularly what does that mean for women's health and safety. Just some housekeeping. If you've got any questions for our panel, towards the end of the webinar, we'll hopefully have some time to put that to the panel. So if you can put them in the Q&A box, that'd be really appreciated. And we will endeavour to get to those questions and put them to the panel. We have BSL interpreters, and we also have live captioning. So please do make use of those functions. And if we can also just draw your attention to our code of conduct, which obviously is just that we want to have a really engaging and welcoming discussion about this really important issue, and everybody should be treated with respect and dignity, and this is a safe space for everybody to talk. So as you know, in line with all our trade union values. So once again, welcome. During the pandemic, we've heard from our members on the front line about the lack of PPE, employers not implementing enough or even any safety measures, the daily risks members are exposed to, and the impact that has had on their physical and emotional well-being. And as more people are returning to their workplaces, whether that's from furlough or from working remotely, we know that many workplaces are still not giving workers the protections and support that they need to reduce risk and keep them safe. As the pandemic continues, we are gathering increasing evidence about the devastating impact that long COVID is having on people's lives and on the lives of workers. It was estimated in June, when there was some research on this, that around 2 million people are likely to be suffering with the symptoms of long COVID. Symptoms such as fatigue, which our own TUC research found that 9 out of 10 respondents to our survey said that they had fatigue, shortness of breath, brain fog, memory loss, headaches. They're all common symptoms. The TUC's research found that people of working age are more likely to be affected. Almost 3 in 10 workers who responded to our survey were experiencing symptoms of long COVID. We also had 80% of the respondents were key workers, and 68% of respondents were women. And we've seen other research starting to emerge that women are more likely to be impacted. We know women are disproportionately overrepresented in key worker occupations, particularly women from Black and minority ethnic backgrounds. And we know that COVID in general and long COVID is having a devastating impact on disabled workers and disabled people more generally. So in light of all this, I'd like to welcome our panelists and thank them for joining us this evening to discuss long COVID, the disproportionate impact it's having on women and the challenges women face in the workplace around this, and how experiences during the pandemic highlight the importance of women's health and safety as a workplace issue. I should just say, in terms of our speakers, we've got a great panel who I will hand over to introduce themselves in a second, but I would just like to send apologies from Sue Coe, who was meant to be joining us, who is our Senior Policy Officer at the TUC. Unfortunately, she's not very well today. She was going to try and troop on, but absolutely, as we know, when you're not well, you shouldn't be working. So I know she's really disappointed not to be able to join this discussion. She leads on some of the long COVID work along with my colleague Quinn, but this is a really important issue, and it's something that she's really keen for us to be talking about as a movement, and keen for it to be shaping our work. So I know she's sad that she's not here, but we will be doing lots more work on this, and there'll be lots more opportunity to discuss long COVID and its impact in general on the workplace. So with that, I'm just going to hand over to speakers one by one to just introduce themselves, and then we've got some questions to ask, so we'll have a bit of a discussion and then hopefully bring the audience in as you post questions in the Q&A box. So first of all, if I can go to Kirsty Stanley, if you'd like to just introduce yourself and tell us a little bit about the organisation and the work that you're doing.
Hi there, everybody. So my name's Kirsty Stanley and my pronouns are she and her. And I am here to represent the Long COVID Support Employment Group. So Long COVID Support started as a Facebook group. We now have over 40,000 members, and a portion of us are working in a multidisciplinary team to tackle sort of work issues that our members are facing.
Great, thank you very much, Kirsty. Michelle?
Good evening, everyone. My name is Michelle Coddington-Rogers. My pronouns are she, her. I'm here to represent the NASUWT. I'm the ex-president for NASUWT, but I also sit on the TUC General Council on the Race Relations Committee, as well as the Women's Committee and the LGBT Plus Committee.
Great, thanks, Michelle. And Hilda?
I'm Hilda Palmer. I've worked at the Greater Manchester Hazards Centre and with the Hazards campaign for over 33 years, and I run a group called Families Against Corporate Killers, which supports the families of people who've been killed through negligence at work. I'm a feminist and a biologist, and I'm a member of Unite.
Great, thank you very much. So to kick off then, what I wanted to ask the panel is, can you tell us a bit about your experiences of long COVID in your work and what the impact has been on your work, for your organisation, for your members or sector? If we kick off with Kirsty, that would be great, thanks.
Okay, so obviously long COVID was named and framed by patients who started seeing that we were having lots of symptoms ongoing after COVID infection. And, you know, a number of sort of support groups sprung up as a result of that. However, long COVID support is the one that I got involved with. I was sick in January last year, so didn't kind of connect it potentially to COVID until a bit later. And joined the group, noticed that everybody was having or starting to have employment issues, you know, managers wanting to let them go, wanting them to go back to work when they weren't ready. And we're just trying to kind of look at processes and structures that are in place to support people to do that and remain well. And I think that's the most important thing, is that you know, we don't want it to be a choice between people's health and work. We need it to be both.
Great, thanks, Kirsty. Michelle, do you want to tell us a bit about what's been happening for teachers and COVID and long COVID?
I think it's very similar to what Kirsty's just said, really. I mean, as we know, the teaching and education sector is about 75% women. And during the last 18 months, obviously, we had education being very much disrupted. And so a number of our members who actually developed long COVID were kind of developing it during that point in our kind of our the COVID journey, I guess is the best way to say it. And so when they were essentially working, teaching from home, they were having these symptoms. And so as we got closer to schools reopening, I was contacted by a number of members who were really worried because they could manage the side effects, I guess, of kind of the implications of long COVID while they were working from home, and let's not forget parents are teachers and teachers are parents, and so they're also juggling all the household work as well as juggling often their children and their children's needs. And they were panicking, they were worried, they were, how do we manage this by going back into school knowing that we've now got to deliver the way that we are expected to deliver education, whilst also managing these symptoms. And a number of our members contacted us to try and get their employers, schools and colleges, to take very seriously their symptoms and how to manage it in the workplace. So I think essentially it was trying to, and as part of our campaign, is trying to get long COVID recognised as a disability so that our members can access, and other members of staff in schools can access the support that they need, because at the moment it's still being debated whether or not long COVID deserves or should get the same recognition. So I think that's just in a nutshell about some of the impact it's been having on our members.
Great, thanks, Michelle. And Hilda, do you want to tell us a bit about your work and the impact on COVID?
I would echo everything that Kirsty and Michelle have said. We deal with a lot of inquiries from all sorts of workers, from safety reps, working on behalf of their members, but also individual trade unionists and people who aren't in trade unions. People, enormous amounts of anxiety and stress around the whole issue, the fear of getting COVID, the fear of being off ill, the fear of developing long COVID, and the impact on women, particularly in terms of many women who are working at home, even though they were ill, being expected to carry on working by their employers. And even though they were ill, still during lockdowns, having to cope with, as has been said, looking after the whole family, trying to do their own work, even though they were ill and shouldn't have been doing it, but also having to homeschool children and having to look after other people. And that's a typical thing, women having to cope with work and a whole lot of family responsibilities. And we've also been trying to get employers to make reasonable adjustments, and obviously getting COVID recognised as a named disability would be easier in terms of doing that. And there is, as Michelle has said, a huge amount of resistance to this from the government. And we've also been trying to get COVID generally recognised as an occupational disease, for compensation and all the rest of it. And all these things are incredibly difficult. But I think fear and anxiety amongst people about getting COVID, and particularly people who are clinically extremely vulnerable or clinically vulnerable, or who have members of their family who are, and trying to handle all these things has been without sufficient support from government or sufficient safety precautions in work, has been enormously difficult for all workers on an absolutely phenomenal scale.
Yes, thank you, Hilda. I think, just to sort of chip in, I think when we did our TUC research earlier this year, we published our long COVID report, and that everything that you've all said was really echoed in that. And what we found was that workers who had spoken to their employers and had that, been really intimidated by actually even having to have that conversation. But then when they had it, they weren't, what they were met with was suspicion and questioning and not being believed, really. And that obviously adds to the anxiety and the pressure. We had members telling us that they'd asked for a change in hours, but only 7% had that agreed by their employer. About 14% asked for physical changes to the workplace to help them do their job, but only 6% had them put in place. And a lot of people were asking for some what are just reasonable adjustments, and actually what they were met with was kind of just not any real engagement on that. And we also, a lot of the respondents to our survey were disabled women, and we found that 1 in 5 had faced questions from their employer about whether they even had long COVID. They were questioned about it. 1 in 4 had their symptoms questioned, and we actually found that 1 in 11 had been threatened with disciplinary action. So there's just a real culture out there that is really not fair for workers. And as more people get it, it's just you can just see this real crisis emerging. And oh, my light's gone off, I'm very sorry. I will just move, there we go, sorry, it's because I'm the last one in the office. But yeah, I think as everyone said, what we're finding is more and more people are recognizing that they have symptoms, but then when they're looking for help and support, the support's just not there. And some of that's because of lack of awareness, but some of it is also because employers, they don't want to engage with this subject and they really need to. So I think I know we've touched on some of them, but I think another question that we had, what are some of the key themes that have emerged regarding long COVID and your work? I know you sort of mentioned people feeling reluctant to come forward. But are there any other things in terms of symptoms or the impact or the kind of things that, you know, members are saying would really help them, or people within your work and campaigning that are saying would really help them in the day-to-day while they manage long COVID? Sorry, I will go to Hilda first.
Okay, I think probably Kirsty will have perhaps more to say that's more useful than this, but just really to, you know, the problem really is employers not believing people. I think for women, there is a particular tendency not to believe women's symptoms, and particularly when the symptoms can be seen to be vague and, you know, very, very various and very diverse. Women who suffer, disabled women who suffer from all sorts of conditions, autoimmune illnesses, ME, you know, chronic fatigue, fibromyalgia, arthritis, lupus, a whole range of illnesses already have enormous difficulty getting their symptoms right. And of course, a lot of these people have been, you know, are doubly affected now by having had COVID and having got all those other symptoms on top of it. And employers have always been very bad about that. But I think employers are very prone, you know, not to believe women talking about their symptoms even more than men. But employers have been emboldened in this by the government's appalling messaging, which was to, you know, cast doubt and suspicion on long COVID, not to really accept it. And even now, they haven't really done that. And that supports, you know, employers in behaving much more aggressively. And also all the nasty messaging about, you know, well, COVID wouldn't really do you any harm unless you had any underlying conditions, as if that was supposed to excuse the fact that COVID was causing people with underlying conditions, which is a huge percentage of us, often not for any fault of our own, for cancers, for genetic conditions, for the fact that work-related conditions that we're suffering from, or existing conditions that we were suffering from, diabetes, autoimmune illnesses, which we're managing perfectly well. Suddenly, all these sort of things in a sort of eugenicist type of way were being used to excuse not even bothering about those people. And I think early on not having the testing system set up, and the fact that a lot of people who've gone on to develop long COVID had very mild symptoms, mean that huge numbers of people who are suffering, have been suffering for a very long time and are suffering quite severe symptoms now, multiple organ problems, don't have a diagnosis of COVID because they didn't actually have a test. And I think what is very good about what has happened is the power and force of organizations like Kirsty's, whereby people who are suffering have been defining this illness by themselves and doing it with such power and eloquence that, you know, a large number of the medical profession and scientists have come alongside of that and are actually, you know, supporting that, and they are leading the way. And I think that has been tremendously positive. And again, I would say that women have been leading the way in all those sorts of organizations. And all of that has been tremendously positive in a very difficult sort of situation. And for organizations like the Hazards Centres and Hazards Campaign, we have depended on a lot of their work in terms of how we advise and support people. But the problem in all of this has come from the government, and it's absolutely appalling, callous and ignorant, anti-science, complete and utter nonsense on COVID, which has caused huge problems.
Yeah, I think everyone can see, round of applause, everyone would completely agree with that. And I think what is also worrying, today they've published their winter plan, and there's a brief mention of long COVID, and there's virtually no mention of any equalities issues, even though we have seen throughout this campaign the way that COVID has impacted different groups and had disproportionate impacts, and there's just nothing in that plan for that. So, you know, it feels like they're not going to change. They've not learned anything from the last 18 months. So it really is up to us as campaigners and organisations to really keep pushing this agenda and make sure it stays on the agenda. I'll go to Michelle next, and then we'll go to Kirsty, who can tell us more about the work that she's doing with the Long COVID Employment Group. But Michelle?
I think adding to what Hilda said, because I think we're going to get quite a lot of crossover and clear kind of the same message, because of this is about the genderization of COVID. Let's be honest, and to kind of pick up from where Hilda left off, our General Secretary, on behalf of our union, wrote to all the devolved nations and highlighted the issue of long COVID and the impact it has on our members. And it's very interesting looking at the differences between the responses. And so I'm sure on the NASUWT website, everybody's interested in how our long COVID campaign is going. The Welsh government came back and very much said, yes, you've raised very important issues. We've included in our long COVID recovery plan. We are taking it very seriously. We are talking about the recovery, the support of our colleagues. Because we know how serious long COVID is and the impact it will have on the teaching workforce and on our nation. Scotland, their response was, we expect employers to apply the Fair Work principles. We're going to be doing research into the impact of long COVID on our workforce, but we expect everyone to treat each other kindly, especially in relation to long COVID, and for employers to help our colleagues to manage it. The response from the Westminster government, I think if I was to say to Hilda and Kirsty, I think you could have written it without even knowing the response. It is very much putting the responsibility back onto the individuals to prove that it's actually long COVID. We've already got the measures in place to support people who've got disabilities. And one of the most concerning lines was, it will need to be tested in court. And that's my kind of I guess, shortened version of the response. And I'm looking at my fellow colleagues on the panel, and they're nodding, because it's exactly what we expect to hear. And that's what the big concern is. In the teaching profession, we already know that we are a caring profession. You can obviously imagine that. And we have a lot of presenteeism. We have a lot of colleagues who work through it, who kind of keep pushing themselves. And teachers, we know from the Working Time Directive, we know that the teaching profession is one where a lot of us do so much work in addition to and outside of our working hours. So we have already got colleagues who move to part-time so that they can do the work. And now we're going to see colleagues who are going to move to part-time because they're even more exhausted, and they're going to still keep trying to do the work, and we're going to find ourselves stuck in a circle. And we're concerned, we are very concerned that it's going to move from an issue which is a medical issue, an equalities issue, and it's going to become a performance issue. And in a profession that is already under recruiting, hasn't got enough staff, can't keep our oldest experienced staff, who are, again, majority women, we're going to see this impacting on education and on the longer term kind of profession. And so I think the overarching themes are very much the same as what Hilda has said, and what Kirsty, I'm very sure, is going to say. It's about how we support our colleagues to make sure that they aren't sacrificing even more. And for a number who have sacrificed, they will continue to sacrifice their health and constantly have that guilt held over our heads, which is it's for the best interests of the children, which has actually meant why a number of our colleagues ignored the symptoms in the first place, because they were trying to just keep going for the children in their own care, but also the children who we are responsible for as teachers as well. And on that note, I'm going to hand over to Kirsty, because I'm really interested in hearing what she's got to say.
Right, how long have I got? I mean, first of all, one of the things that hasn't been raised so far that I think is really important to raise is the fact that long COVID also affects children, and parents who maybe have long COVID themselves also have to care for their children with long COVID. So it's not just a case of them, looking after themselves and getting into work. They've got all these other responsibilities as well. And if they've got a clinically vulnerable child at home as well, they're going to be very anxious about going into work, contracting COVID, bringing it home. So that's kind of one theme that has come up. A big one, and Hilda and Michelle kind of touched on it, is gaslighting from the government, from the medical profession. I'm an occupational therapist. That's my clinical background, and you know, what has happened with people with ME CFS in the past is repeating itself with long COVID. And actually a lot of people with long COVID are now going on to get a diagnosis of ME CFS. Which is, you know, it's a recognized disability. There is biomedical research to show that it's real, as there is in long COVID. There, you know, long COVID is an umbrella term, and I think that's really important to be aware of. It kind of fatigue kind of keeps being brought up, but yes, organ damage has been shown in some people. Lots of people are getting sort of orthostatic intolerance, so POTS, so they're feeling dizzy. Heart rate, my heart rate shot up to 130 doing the stairs earlier. My sats dropped to 91. It's causing real symptoms, and real symptoms that a lot of us had investigated properly. So people are being pushed back into work when actually we don't know if they've got organ damage, because they haven't been able to access that treatment. So the long COVID clinics that are set up are very, very variable. It is a bit of a postcode lottery as to how people are getting access to that. And also it depends on your GP and how your GP responds as well. So, I mean, the first thing I would kind of urge any union rep to do is, if people are saying they've got long COVID and their sick notes, for example, or their fit notes aren't saying long COVID, support them to speak to their GP or occupational health to get that counted. So count long COVID is a hashtag you may have seen around on Twitter. If we don't count the numbers, it can be brushed under the carpet. So yeah, definitely move on there. The other thing is that pre-existing systems, even for people with named disabilities, such as cancer, multiple sclerosis, which is the area of clinical practice I worked in. I actually left the NHS pre getting COVID, but even when people have a named disability, they are still discriminated against. And we need to be pushing employers to do more than the bare minimum. One of our big campaigns has been about phased return to work. Most people have either you've got to be back to full time within 2 weeks or 4 weeks, and we know that that's just not feasible for people with long COVID, especially when they're a woman who's got all the housework to do, got everything else, or like myself, single, and is responsible for all the bills myself. So, you know, there's lots of pressure on women. It's not just about work. And, you know, as an OT, one of my big things is you need to look at that person in their entirety. You need to look at their whole life and making sure they can do it all, not just come into work and collapse all weekend.
Yeah, great. Thank you, Kirsty. Again, really great contributions from the whole panel. And I think, you know, we're all kind of singing from a similar sort of hymn sheet, really. And I think that's, again, that collective voice on this is going to be really important, because as you know, as we've all highlighted, like, the government really is not interested in this, and so it's, you know, it's a key thing for us to be pushing on. I just wanted to ask as well if anyone wants to come in, or I can come round to people, but we've touched a little bit on some of the ways in which long COVID and the pandemic is impacting on women's health and safety in the workplace. But I just wondered if people want to expand a little bit on that in terms of like particular experiences with people that they're working with, and also, you know, how it's put women's health and safety on the agenda, and sort of what we can do there and how we can develop women's health and safety in the workplace. So I'll come to Michelle first.
Thank you, Nikki. I mean, we also need to recognise that there's a whole responsibility on self-reporting in relation to long COVID, and I think the ONS published their statistics at the beginning of the month in September, and they identified that actually it's women of an older age and they who are developing long COVID, and there's a potential there could be linked to menopausal age. All those aspects, but we haven't got the research, and so until we get the research, it's not that we can't do anything. We have to support our members, and we have to support our colleagues and our friends and our family, and make sure that they are able to continue. The research doesn't stop the issue, but the research isn't there, and we need to, I think one part of the campaign needs to be to call for the research to make sure it's intersectional, because at the moment the ONS statistics are not intersectional. They look at women as one group and BME or Black people is a different group and age is a different group, and actually we need to have a better picture of what this is. And both Kirsty and Hilda said this symptoms could vary from the person sitting on the bus to the next person sitting on the bus to the child sitting in front of them, and so we haven't got that information, but we also need to think about how we join all of this up together as well for our colleagues. When we're supporting people with disabilities, a number of people with long COVID do not see it because of the stigma and the stereotyping around what a disability is and what it looks like, and how workplaces respond to disabilities. I think it was both Kirsty and Hilda who touched on this earlier, and so we've got a number of colleagues who don't want to be put into that category, because then we're talking about leaving the workplace. And for teachers, we are in front of a class of kids. You can't do that from an office somewhere sat down. You can't do that from, as much as we tried, from home. Kids refuse to turn on their cameras, refuse to engage. It's really hard. And so for a number of our colleagues, they would see this as possibly the end of their profession and something that they've given their all to and sacrificed so much for. So I think we've got to open that conversation and recognise where it intersects, and to make sure that our colleagues and our friends and our family see how that intersecting space is also a space of opportunity as well. And it's a space to build networks like with Kirsty and her organisation, and Hilda and her organisation, and all the support groups out there, to make sure that people are seen and that they're able to get the support and the recognition that they need. Because navigating that whole new life and what the expectations are is not as straightforward, and people sometimes avoid it out of fear, out of worry, out of concern, and sometimes just not knowing where to start.
Great, thanks. Kirsty, do you want to come in?
Yeah, I'd love to build on what Michelle was saying. Obviously, the disability issue has come up in the group a number of times, and yes, people are quite reluctant. I think in some respects I was lucky that I had pre-existing conditions, so I was already part way on that journey to acceptance anyway, which has changed how I broach my life moving forwards. I think, again, as union reps, it's about communicating to people that this is a legal definition around disability. It's about offering you greater protections in theory in work. So if anybody has been off sick for a year already, they are going to meet the Equality Act definition of disability. If they look like they're going to be continuing to experience problems with their day-to-day living, they are going to meet the criteria. Unfortunately, like you said, Michelle, yes, it's going to be in an employment tribunal where they actually agree that, but we want employers to do better. We want them to support people and definitely support really good workers that do put in their all. They do all those hours. They've given everything. A lot of the people are frontline workers, so teachers, healthcare staff, who basically kept this country going throughout the pandemic, and they're being abandoned, and that's how they feel now. So support them to say, okay, you may not want to define yourself as disabled, but for an equality point of view, you meet the definition of disabled, and we can use that to request reasonable adjustments from your employer. And then the other comment you mentioned was about sort of hormonal issues, and yes, the hormonal stuff is huge. I have about 1 week where I'm okay, and then up to the time of and after is a bit of a nightmare. And you know, a lot of women are experiencing this, but this is something that just doesn't get researched, full stop. So that variability from person to person is also a variability from day to day, week to week with the same person as well. So I think there's that to consider.
Great. Hilda, did you want to add anything?
Yes, I think really one of the things that this shows is just how, well, I mean, the health and safety system in Britain was broken before COVID. COVID has exposed that. It didn't cause it, it's absolutely caused it. It's absolutely exposed it. But what was also very true before COVID was how women's health and safety was almost virtually ignored. Kirsty and Michelle have both talked about, you know, the need for more research. We don't have that research, but we don't have very much research on women's health and safety at work. It's ignored. The worker is assumed to be a default male, and tools and equipment and the work schedule and everything, whether it's in work where men and women work together, whether it's male mostly work or female work, in all workplaces, you know, we are suffering from this in that the whole way that work is designed is for men. And things like, you know, women, Kirsty has mentioned it, women's, you know, life of hormonal changes, you know, periods, pregnancy, childbirth for some of us, menopause for all of us, all of those things throughout our lives, they're just not factored in. Manual handling research doesn't take account of the fact that women have breasts. You know, there's almost no research on how, you know, women and men do their jobs differently, and gendered assumptions about the fact that women's work is generally light and non-taxing and unskilled and all that sort of thing. Whereas if you actually observe it and measure it, you can show that women's work is actually much harder, and that women and men doing the same job, like teachers, do it very differently. Women teachers do much more emotional work. This is something you've talked about. I mean, both teachers of both sexes care, but women do far more emotional work. They also have to do far more work to avoid sexual harassment if they're in co-ed schools and all that sort of thing. Women baristas do their work differently. They have to scurry around the outside and walk more because they're trying to avoid tables of gropers, and they have to behave more, you know, do more emotional work with the people they're serving in order to get decent tips and not to be criticised. There are all these sorts of things based on the biological and anatomical sexual differences between the average man and the average woman, which make work less safe and less healthy for women, and then the gendered assumptions on top of that. And I think all of these things come together in COVID in an absolutely terrible perfect storm in terms of how women are treated and how also women think about themselves, and the pressures upon them and the ways they're caught up in all these very conflicting and damaging sort of pressures upon them. I think that's going to be very, very difficult for the future. And already, you know, women feel, you know, that they're not going to be taken as a background. A lot of women feel a lot of shame about the fact that they can't work in the same way as men work at work. And that's because the job isn't designed properly for them, and the work organizations and the work schedules aren't. But they feel ashamed and they feel guilty about all the other, you know, gendered sort of work that they're supposed to do as well. And I think that because of the way COVID and long COVID is affecting people, affecting women themselves, but also affecting other members of their household, whether they've got clinically extremely vulnerable or clinically vulnerable people in their family or their children, they're having to manage all of that and manage their work. And I think as teachers and as health workers and as carers and a whole range of other workers, caring a lot about the people they work for, caring a lot about people at home, it's going to leave women exposed even more in the fact that the person who needs the most care themselves is going to actually miss out. And I agree with, I'm not going to repeat it, but I agree with everything that Michelle and Kirsty has said.
Yeah, thank you. I think just to pick up on a couple of points, Kirsty, where you were saying about like your symptoms and how they've changed, and how, and hormonal differences, and how it can be different from day to day and week to week. Our TUC research that we did earlier in the year, 94% of women who responded to that survey who had long COVID symptoms said that their symptoms fluctuated, and it would be, become worse over time, but also from day to day. Like, they just didn't know what to expect as well, which added more anxiety. And again, from a sort of how to sort of deal with day to day, all of your other responsibilities was just making life really hard for them. And I think, as everyone's pointed out, there's just so much here that we need to know more about, and we need to be getting more information, and we need employers to be helping us get that information, as well as through our union networks and our campaigning networks and our research networks. I think we've touched on some of these points, but I thought what I would just do is ask one more question, and then I'll take a couple from the Q&A, because we've had a few come through. So thank you to the audience for sending those through. But in terms of workplace organising, and I suppose organising more broadly, actually, because I think, as we've all said, we're still trying to raise awareness of long COVID in general. So what sort of practical steps do you think we need to take to get this issue higher up the agenda with employers in our workplaces, and also, with family, friends, whoever, to really kind of get people to understand the seriousness of long COVID and the long-term impacts it's going to have, not just on people's health, but, as you said, like when you look at people in the round and their lives. Because I think another point, sorry to just pick up on what's already been said, is because we know that more women work in the care sector and tend to do more of the care in their homes and stuff, it's also women who are going to be caring for people with long COVID. And so, there's a whole spectrum of issues there that we need to sort of think about and tackle and look at in an intersectional way. So I'll start with Hilda. So yeah, what, in terms of your campaigning, what are the kind of key asks? What should we be saying to raise awareness of this, and what should we be doing as well?
Okay, well, I think first of all, we have to use, there's huge amounts of information out there. The TUC, trade unions have put together, organisations like Kirsty and other organisations have put masses of information together about what long COVID is, what the symptoms are, and have worked really hard to provide, whole lists of advice and information. That is there, and I think we have to use that, and we all have to. I think, as Michelle said earlier, when somebody, if we're safety reps or a rep at work, when somebody says they're suffering from long COVID, we believe them. We believe them, and we make this clear. And we oppose and we challenge everything that the government is saying. And Kirsty's phrase, gaslighting, it's lying, of course, but we use gaslighting to be polite about it. The government's gaslighting on this has been absolutely obscene. And I think we challenge and expose that at every possibility. But we use all that information, that hard-won information that you've got, to make it, to use it in all our campaigning, and to have it up there, and to be very clear, this is what we know is happening, this is what we believe, this is what should be done, this is what we need in terms of research, this is what we need employers to be doing in terms of reasonable adjustments and support. And we also have to make it very clear that if we don't do this, we are going to have, it's a disaster for the people who are suffering, it's a disaster for families, and that is a good enough reason to do it. But we have to make it clear that this is a long-term economic and social disaster if we don't deal with it. We have huge numbers of people, particularly women, who, as someone has said, have been the essential workers who've got us through the pandemic so far, and now exhausted and suffering from PTSD and long COVID and all the rest of it. If we don't support them, all those people who do this really vital work, how the hell are we going to survive? It's going to have an absolutely enormous impact on the economy, and obviously terribly impact on individual families. It's going to have a terrible impact on the NHS. The NHS can't cope with long-term illnesses and disabilities of all sorts at the moment, and isn't providing those care. The long COVID clinics, as you say, are very variable, and they're not available to everybody, and they will have huge waiting lists, and we will not be able to deal with them. And women who maybe have long COVID themselves, have members of their family or children with long COVID, how the hell are they going to be able to work? I think we have to be very out there and very explicit, and not brook any nonsense from anybody, any of the gaslighting or the lying or the nonsense that's being provided, and make it very clear that we believe in this and all the things that need to be done, and that we need masses more support and masses more research and action on long COVID, directly to families who are suffering, directly to the people who are suffering, in workplaces, in the NHS, everywhere. And we have to make clear that this is a result of the government, of Boris Johnson being intensely relaxed about bodies stacking up and about 1,000 people dying every week. He's relaxed about 50,000 people dying. He's let COVID run riot. He's let COVID run riot in schools. Schools are terribly unsafe, and day by day we will see the surge in school children and teachers and families from that. And we need to make it very clear, this is the government's failure to suppress COVID. It is not poor individual people's failure to get it. It's the failure of the government to make sure that schools and all other workplaces and all other public places have been kept safe by the use of good ventilation, source control masks, proper PPE, social distancing, and all the rest of it. It's the government's fault, it's the government's failing, and they must do something about it. We must stand up behind people who are suffering absolutely vigorously. And as Kirsty and Michelle have said, we must network together, and we must, make sure that women's health and safety is very much to the forefront of all of this.
Thank you very much, Hilda. Kirsty, do you want to come in next?
Yeah, so in terms of what trade unions can do to support members, be their voice. One of the things that surprises me, I actually got ill health dismissed from the NHS prior to COVID happening, and I was quite unwell when I was attending all these appointments, and my union rep said nothing. I had to do all the talking, and you just get to a stage where you're just exhausted. You can't do it. You need somebody saying, no, this isn't right. You need to consider X, Y, and Z. So things like, we're aware that this is likely to be considered a disability. Can we consider any leave or absence related to the disability separately from other absence? Can we consider a longer phased return because this person has a disability? All of those sort of things need to come from the union reps alongside or supporting members to kind of say them. Because workplaces, unfortunately, they will try and get away with it. They've got to run a business, and we understand that. But the alternative is the benefit system, and we also know that's broken. So we want to keep people in work, and we need to support them back into work in a sustainable way, and considering all of their other things. And also go back to people's job descriptions. Look at what they have to do as part of their job, because women take on a lot of extra stuff that they don't have to do, and give them permission to drop that. Give them permission to not do the birthday card list or whatever, so that they can actually just focus on the job that they're getting paid to do, and looking after themselves and their children and their families, etc., etc.
Yeah, great. Here. Michelle?
If there's any message we take from that, I think, Kirsty, it's doing what you're paid to do. I think it's on many levels, and I wouldn't be a teacher if I didn't sit here and say it starts with education. I think we need to be making sure that employers are actually hearing what long COVID is and the impact it has, and not presuming that they know. But actually, I think that's where I think it was Hilda who said about building networks and using that opportunity to educate. And that's something we can do locally and nationally, and making sure that they're hearing it from the experts. Forget what Michael Gove says. Let's listen to the experts and the people who know what they're talking about. The equality impact audits, I saw somebody mention that briefly in the chat. Our union was one of the unions that at the very beginning of COVID, the kind of the pandemic, and the government making these big grand statements about schools, called on the equality impact audits to be published, and we're still waiting. We're still waiting, and we're still waiting, and we believe that this is something that the government should be releasing, the impact and what it has had on people who have got particular characteristics. And the fact that they're not releasing it means that they know something that we suspect, and they've probably got the evidence, and they're refusing to publish it. And so we need to put pressure on them nationally, on the devolved nation governments, all of them, to make sure that they are doing what is expected, what is right, and what our provisions already are in law. From an NASUWT perspective, there's also the recognition that let's be honest, we're talking about women's health here. And if women and our members do need to take ill health retirement, that they aren't punished again. They aren't punished already. We know that women's pensions are disproportionately affected by changes, by all the reasons why women take time out from the workforce. We don't want women who have found themselves in a situation where they can't carry on because they're doing all those extras, as Kirsty has very rightly noted, and they've got the additional pressure and the guilt, which Hilda has talked about, that they finally get to a place where they recognize they can't carry on. There shouldn't be any shame, any guilt, or any punishment as a result of it. And so one of the parts of our campaign is we're campaigning to make sure that the teachers' pension scheme recognizes long COVID and doesn't penalize women who need to take long-term, who need to take ill health retirement. And that links into the financial compensation as well. And I think this is what we can do jointly as unions and as civil society in the third sector, is putting pressure on the government, and in this instance Westminster government, to make sure that there is adequate compensation, that there is injury compensation, that it can be and it will need a test recognised as an injury related to work, because for a lot of our members, they are adamant, and there's no other way that they could have caught COVID if it wasn't in school. And again, coming back to that gaslighting, how it's very hard to prove it, but we need to make sure that we've got those financial compensations in place. And the statutory sick pay, it's inadequate, it's stupid, it's silly, I can't use enough words of how much it is used as a stick to beat someone with to keep them in work. We need to make sure that people have got the opportunity to recover and to rehabilitate, but also, as Kirsty said, to come to terms with what their body can and can't do now. And so many people, it's emotional, it's mental, and it's not just the physical. They need that time and that space to adjust and to recognize that sometimes we're our worst enemies. We don't ask for help, and that's where we need that space to be able to ask for help. So that's in addition to everything that's been said already.
That's great, thank you, Michelle. And yeah, I think as everyone said, like, it's just, as we've said throughout this discussion so far, it's just so important that people understand how serious this is and how far reaching the consequences are, and that people do have that support in place. And I think, we know that there's so much good work going on, and so I feel really positive about how we're pushing forward with this, and I think that's a really nice message to come out of this webinar. But we do know we've got a long way to go, and as I say, with a government that is this unresponsive as well, it is difficult, and it will take shouting from the rooftops. I'll just try and sort of bring in a sort of a summary of a question in the chat, and try and bring it to you with a bit of a summary, and then if you've got any closing remarks. I just did want to point out that a participant has quite rightly pointed out that at the TUC we do adopt the social model of disability, and so when we're talking about disabled women, disabled people, and we need to make sure we're using the right language. And so apologies if any of us made a mistake. It would not have been intentionally done. I wholeheartedly know that, but thank you for pointing that out to us. And I should say as well, in terms of things that the TUC is asking for as part of its long COVID campaign, one is that, we do, the government employers, everyone does adopt the social model of disability. And as Michelle has said, the equality impact assessments are, that was a motion that came from Women's Conference this year. It's been to Congress this year. It's a really, on all policies that the government's doing, like, we need to see what they're up to. And we need, it needs to be put out there. And why aren't they putting it out there? It makes no sense unless they don't want us to see how they're making those decisions. What I just wanted to kind of ask the panelists as a sort of closing remarks is, there's been a few questions about, what data is out there. And I know panelists have all said, there's not enough out there, definitely not, whether that's on long COVID or women and health and safety in the workplace in general. So I just wondered if anyone has any pointers to any data or research that might be coming up, or that they know that they're doing within their organisation, if you want to kind of make us aware of that. And then also, if you just have any closing remarks on, what needs to happen next, and just any final reflections on the webinar, that'd be great. I'll start with Kirsty.
Sorry, I couldn't unmute then. I mean, in terms of data, I think it's difficult because, like you said, a lot of it is self-report, and it's not being counted properly. And one thing that I would probably like to leave and kind of urge unions to do is, if you're starting to get 2, 3, 4 people in your workplace that have got long COVID, can you urge the employer to do something proactive, to ask who is having those symptoms, to put them in contact with support groups, with each other, to consider them as part of the workplace rather than necessarily part of just their job. I'm sure that some women could get back to work and do some work. It might not be the role that they were employed to do. And actually, we know that work can be good for people and can be good for recovery, but it has to be the right kind, the right amount, etc. So work could actually be used as a rehabilitation. But unfortunately, what we're seeing is they want people to come back and be able to do exactly what they did before, rather than actually use their skills and expertise on doing something, rather than being off sick and not doing anything.
Great, thanks, Kirsty. I'll go to Michelle. I'll go to Hilda next, and then Michelle, as our union person and with a lovely Congress 2021 background, can have the final say. So, Hilda.
Yes, I think data on long COVID, there is a lot out there. That it's problematic in terms of how it's seen and how it's accepted, and it's very variable. And obviously, one of the things we require is a lot more proper collection of data and presentation of it. But I think, over and above that, we must still maintain our role that we know it's happening, we know it's real, we know it's multi-organ, we know it's multi-symptom, we know it's varied, and that workers, it's a disability, it's disabling people, it's causing people problems, it's reducing their capacity, and that means that we've got to do more things about it in work, rather than just waiting for the research. We've got enough to be acting on it now. And I think I would just want to say that I think we, as well as working on long COVID, we still have to keep up our fight in the workplace in terms of precaution, prevention, protection, and participation. We have to ensure that we are trying to stop COVID being transmitted. That's very difficult because the government's messaging is anti-science and anti-fact and absolute nonsense. And they have allowed workplaces and schools particularly to open in an unsafe way. And we have to do what we can within our workplaces to say that whatever the government guidance is, health and safety law still applies, and that requires proper risk assessments and then safe systems of work following the control hierarchy, which starts with eliminating the most hazardous things, like, for example, full assemblies and large classes and things like that, and keeping people who are vulnerable or who are infected out of the workplace. And the government has messed that up as well in terms of changing those requirements. But also things like keep up our efforts to make sure that ventilation in classrooms and in all workplaces has been improved to prevent and reduce airborne aerosol transmission. But you still need to wear source control masks, because close range aerosols won't be affected too much by ventilation, to use HEPA air filtration if necessary, to use carbon dioxide monitors and keep the carbon dioxide level below 800 parts per million, which is a level representing as a proxy for good ventilation, and try to keep as few people in shared air for shorter times as possible, and make sure that there is as much social distancing as possible. So we have to really work very hard at that, and it's very difficult since the government has removed mask mandates and removed all the issues about social distancing and not made sure, and the HSE is not insisting or not going and enforcing workplaces to improve ventilation and put all these other things into place. It's very, very difficult, but we have to do that, because as well as working with those people who are suffering from long COVID, we want to do everything we possibly can to prevent children in schools and workers in workplaces and all people, all adults, from actually developing COVID in the first place. And hopefully then we will stop more people from developing long COVID. And I apologise if I've talked about disability the wrong way. I do apologise. I'm sorry if I've done that. Thank you.
Oh, thank you, Hilda. And so, Michelle, I'll leave you to have the last word. As I said, as our Congress representative, and also, as Michelle said, a member of our Women's Committee, where this has come up in a lot of our discussions recently and motions from Congress. So, Michelle, over to you.
I just want to say thank you very much for this webinar and for the contributions. I think it's really crucial that we're having these conversations, but we're also coming out with actions after it, and bringing together people who are doing the work and campaigning and saying that actually we're speaking with a united voice, and holding the government to account. That's where a lot of this needs to sit. But we also need to make sure that we're there to support our members as well, whichever union, whichever sector, that our members are supported. And I wouldn't be a unionist if I didn't say it started with policy. It starts with having it on paper, but it's not about just having it on paper. It's how that paper is turned into action. And in schools, we've seen a lot of schools talking about well-being, which usually means a yoga session in the school hall. Actually, let's talk about the reality of well-being. Let's talk about the reality of how we can create spaces for especially women to talk about health issues and the impact it has on their working lives, but also creating a space where we can talk openly and honestly about what we need and being able to articulate what we need. And I think that's the role of the trade union movement. The trade union movement has to create a space where we can say what our members need, but like Kirsty said, when our members are unable to articulate it, the trade union movement has to use the strength and the power that is behind us to be able to say it, and not have our members and individuals feel like they're alone. And I'm really glad that it was raised around the social definition of disability and having disability in people with disabilities, because actually that's what has kind of been missing, I guess, as part of this discussion around the pandemic and its long-term effects. So as far as I'm concerned, and as far as as a member of the TUC, this conversation is ongoing. It's not stopping here with the webinar. It's not stopping here with the motions that are passed at Congress. It's not even stopping with the individual trade unions kind of adopting policy and push. Actually, this is ongoing. The COVID inquiry will be a small part of this campaign and of this work. And I say small part because it is not going to have all the answers for all of our members and the people who have been affected. So we all have to use our united voice to keep pushing forward on this and making sure that anybody who is affected and the long-term effects of long COVID don't feel like they will they're going to suffer and be punished 2, 3, 4 times by our society, by the world of work, and by our communities. This is going to impact all of us, and we have to look after each and every one of us. So thank you very much for the webinar.
Great, thank you to all of our panelists. I think it's been a really interesting discussion. Some real, as you say, real actions that we can take forward, and certainly a lot for myself as Women's Policy Officer at the TUC, but also within the Equalities team, for us to kind of take away and think about, you know, what, now that we've done some research, like what do we do next? How do we help support our affiliates to make the kind of recommendations that we've made into reality? And also, you know, what can we be doing to support reps through our TU education and things like that? So I think a lot for us to reflect on, and a lot for us to take forward and act on. And just a huge thank you again to all of our panelists for bringing your expertise and knowledge to the webinar, and for helping to close Congress 2021. And thank you very much to the BSL interpreters and the live captioners, and also to Shelley, my colleague, who has been manning the tech for me, so that I'm not too distracted and able to support everybody. But thank you so much everyone for joining us as well. And as Michelle said, this is not the end of the work. This is just absolutely the beginning. And as everyone has said, you know, we need to be shouting as loud as we can, the collective voice, and taking action together. And I think that's a really great note to end on. We have recorded this, so it will be available on our YouTube channel in a couple of weeks or so, so we can let people know when that's available as well. But everyone, take care, stay safe, and have a good evening.
Thank you. Thank you very much.